What's up? It's your favorite NPHP and welcome back to my channel. So as you can see by the title, should you become a nurse practitioner this year, 2024? So should you become a nurse practitioner in 2024 or this year? Well, according to the U.S. news reports, nurse practitioners came in at #1 as best ranked job out of 100. So that's amazing. The U.S. news took a look at more than a dozen industries to find the best jobs, measuring the median salary, predictive growth, unemployment rate. They also compared jobs based on work-life balance and stress level. The data that was used to collect this information came from the U.S. Bureau of Labor and Statistics. So yes, the top 5 jobs I listed here, with nurse practitioners again coming in at 1. The second is financial manager, software developer, and IT manager and physician assistant. As you could take a closer little look, the median salary of nurse practitioner is the lowest. But if you take a look at the unemployment rate and the job growth, the unemployment rate is 0.6%, not even 1%. And then the job growth, 44.5%, or 118,000 jobs. Due to the unemployment rate and that job growth, that is what set nurse practitioners at #1 as best jobs. Job security where? So that's what brought us in at #1, I feel. The aging population and the growing prevalence of chronic conditions, that is what drives the strong projected job growth. At the same time, according to AAMC, or the Association of American Medical Colleges data, the United States faces a projected physician shortage of up to 124,000. So again, our job growth is 114,000. The physician shortage is 124,000. It's almost equal. So as we lose a physician, we have a nurse practitioner position opening up. Your job security, unemployment rate is low, and we're going to have many jobs, many opportunities. At the same time, nurse practitioners ranked #1 again for best STEM jobs, as well as #1 in best health care job. We're ranked #1 best job, ranked #1 best STEM job, and ranked #1 best health care job. So should you become a nurse practitioner? Yes, you should. Based on this data, you should. I mean, there's more things you got to look at and consider, which I'll discuss later in this video. But yes, at the end of the day, job security, low employment rate, the projected job growth is very large, and it's only going to grow due to our aging population and then the loss of physician. It's like we're set up for just a long growing career. Those are reasons that you should consider. I also found some good information about the top 10 states for nurse practitioner growth. New York coming in at #1 with 21,000 new jobs. I also came across the top 10 states for nurse practitioner job growth based on percentage change, and Georgia came in at #1. A little bit above New York at 41.4 job growth by percentage change. So I don't know where all my followers are from, but this is some nice information to know about what state is having the most job growth if you are planning on moving, and the most job growth by percentage. So putting all the measurements aside and looking more at a personal note, if you are stuck and unsure if you should really become a nurse practitioner, obviously it is an amazing job based on the numbers, job security in general. I did come up with a few things that you should think about or consider before becoming a nurse practitioner. First thing being, are you willing to work in full autonomy, trusting your own judgment? So after getting your proper training in school, after passing your boards, and you have several job offers, are you going to have the confidence to work in full autonomy? When I say full autonomy, I'm in my own call room. No one else sits in there with me. I get paged directly. And so I get questioned about an acute change in the patient. Will I feel comfortable based on my knowledge in school? I passed the boards. Will I feel comfortable, going head on and answering and treating this patient? So after getting the proper training in school and based on the amount of liability like you may now have, you went from a bedside RN, now you're a provider, will you feel comfortable? Will you feel confident? And I'm asking this because I know several friends, several nurse practitioners, not even nurse practitioners, just several master's trained nurses. So if it's CNS, nurse practitioners, whatever it may be, they decide not to practice. They get their degree, pass their boards, but they stay at bedside. And few of them had said it's because of the liabilities. Again, you went through school, you got the training. Okay, yes, some school might not be the best training, but you go to school, you get the training, you pass the boards, but then the liability. And I'm just like, it's not the liability. It's obviously the fear. It's the fear. And at the end of the day, who's your higher power? You need to be praying for confidence, for wisdom, whatever you need to get rid of that doubt, get rid of that fear. Because like I said, you went through school, you passed the boards, but just because of liability. At the same time, well, we get paid. It's an autonomous environment, but my thing is we're never alone. We collaborate. Well, here in Ohio, nurse practitioners do not work independently. You have resources, you have tools, you have fellow doctors that you work with to bounce ideas off and ask them questions. So yeah, at the end of the day, it's like you have to figure out, will you have the true confidence? If the liability is a big thing and you're not willing to seek any further help from the higher power to work independently, or not independently, but work as a nurse practitioner with the amount of liability that you will have now, it's a lot more than nurses. You got to figure that out. You got to figure that out if you're considering and thinking about going back to nurse practitioner school. So that was number one. Number two, it's basically, what are your interests? You have to make sure you know what your interest is. What are your interests? And make sure whatever path you take, so FNP, acute care, primary care, neonatal, pediatric, you got to make sure whatever path you take in school, specialty you focus on, that whatever job you're trying to land accepts that specialty. For example, my hospital, I might be wrong, but my hospital, the emergency room only accepts, I want to say FNPs, acute cares, FNPs and acute cares. My point is, you might have to do some research. You might have to go to the whatever hospital system you may find yourself working at, or whatever nursing home and whatnot, and just make sure you have the right credentials or the right degree for it. Me personally, I did not want to become an FNP. I knew that I did not want to care for children. And I stand on it today. Just emotionally, I just know I can't handle it. And that's something you really have to know and find out. Like, I just personally cannot care for kids, and I know that. And it's not being negative or anything. It's just, I'm not going to come to work getting so emotionally attached. It's so emotionally involved that will ultimately lead to burnout, lead to me hating my job caring for kids. So I knew I did not want to become an FNP, nurse practitioner. Yes, it might give me more job opportunities, but again, it's not even about the job opportunities. At the end of the day, I don't want to care for kids. So you got to know, if you want to care for kids, if you only want to care for kids, you might want to go the neonatal pediatric nurse practitioner route, or psych. You have to know, if you want to become a psych NP, that's all you're going to do for the rest of your career. You could always go back and get add-ons of critical care, but if you want to become a psych NP, know full well you have to know you're not going to end up in the ICU caring for patients. You're going to do psych NP stuff. So just make sure your degree aligns with your future job. You have to make sure you just are on track, because you don't want to go to school and basically waste time. So did that make sense? There's so many specialties: children's, emergency, oncology. I know oncology is acute care, orthopedics, urology. You just have to know and ask around before you sign up for school and choose your track. So third is a must we have to discuss. So it's money, based on my experience with nurses and the nurses who are open with me. Because I've been working at the same hospital for 7 years, so I'm close to many nurses. So, and I know a lot of them love to make money. They love picking up the overtime. They'll take travel assignments here and there throughout the year and then come back. I don't want to call it fast money, but you could make a lot of money pretty quickly by picking up extra shifts as a nurse. Versus when you do become a nurse practitioner, you are very limited. Again, based on my experience, we currently do not get paid overtime. First of all, we're salary, and I want to say majority of nurse practitioner jobs are salary. You might find a few that are not, but we are salary, and we do not make that much overtime. When I say not that much, we were offered overtime during COVID. We were only down to 2 nurse practitioners. We were supposed to have 3, so during COVID, there was only 2 of us. So I was picking up 1 extra shift a month just to help out. So again, if you're used to making a lot of money pretty quickly, nurse practitioner might be a hard transition for you. You got to understand, salary based, we get paid monthly. I was just talking to one of my good friends the other night, and she was like, "You get paid salary?" I'm like, "Yeah." She's like, I could never. I said, "It was rough." When I first started, it took me a good 3 months to really get used to getting paid monthly. I had to really budget, sat down. I made Excel sheets of my bills, because you don't want to run out of money towards the end of the month. So you do have to consider that if you're a nurse that picks up a lot of overtime. At the same time, since we do not get paid overtime right now, I have fellow nurse practitioners who did go back to bedside just so they could pick up extra. extra. So I feel like just knowing that going in, like, are you willing to take out more loans, go back to school, knowing that you do love to make extra money, you probably will end up still practicing at bedside. Mind you, if that's what you want to do, that's what you want to do. I'm giving you ideas and just to broaden your outlook of things. Would you rather stay as an RN, continue what you're doing, making a lot of money, picking up overtime, versus becoming NP, making the same amount, could be making the same amount and working less, or even as an NP, if you still want more, you might still see yourself going back to bedside. Again, different scenarios you should consider when it comes to money. So the last one here will help you determine if you should go back to school like now. Like I asked, should you go back to school this year? So are you ready to go back to school right now is the question. So my question here is, how is your current thinking process? As a nurse, I'm talking to nurses. How is your current thinking process? Are you one of the nurses who come into work early, look up your patients, look up the medications, reading like the care plan, reading doctor's notes, or whenever you get your first downtime, do you pull up the notes, trying to understand the full clinical picture? Do you look up medications before you give them? You should. That should be protocol. Every nurse should be looking at medication. But do you look at medications and then figure out and then you're trying to figure out like, why are they on this medication? Why do they need it? Why is it given 3 times a day and not just once a day? Why are they on that antibiotic for whatever infection they may have? Just like your curiosity, or do you see yourself just thinking more into your patient's overall clinical picture? Do you see yourself trying to figure out more? And then do you question orders? Like if I put an order in, do you question orders? Why did they just order a lipase? Why did they just order a lactate? I paged them and I said the blood pressure was low. They do have an infection and they ordered a lactate. So do you question why are we checking a lactate? This is more geared to the newer nurses. I know the seasoned nurses who's been practicing for many years understand a lot. Do you question orders out of curiosity to learn and understand more, to fully understand the clinical picture? So I have many nurses that I feel based on how they page me with the detailed information, you should be going back to school. I see that you're looking at the whole picture, you're understanding. So when I see nurses page me with more detailed info, those are the ones I'm like, yeah, you should go back to school. So for example, I'll have a nurse who maybe will page, patient CK is 3,000, and that's the page. Again, I'm a nocturnal nurse practitioner, so I work night. I don't know these patients at all. Until you page me, that's when I have to click in the chart and figure out what's going on. So when you page CK's level is 3,000, I have a million questions. I need more info. Versus a nurse that will page patient CK is 3,000. It's downtrending. Previously 6,000. He's here with rhabdomyolysis. He is on maintenance IV fluids at 100. We are cycling his CK at Q6 hours. My response to that is, okay, continue to cycle Q6 hours because he's on the proper treatment. It's downtrending. I don't have to do too much digging. And you guys are helping me out a whole bunch because at the end of the day, I am busy. I cover, which could be another video I could discuss exactly what I do, but I cover almost 100 patients for the first 2 hours of my shift, and I dropped down to 60 patients. Still a lot, 60, 65 patients. Still a lot of patients that I'm cross-covering. I do 2 to 3 admissions at the same time. So when you see that nice, concise, detailed information about the CK, the history, the diagnosis, the treatment, what we're doing, how we're following, you understand the full clinical picture there versus the page I got, CK's 3,000. When I do get a page like that, I question, is it downtrending? So at the same time, I do go in the chart and try to figure it out myself. But I already know the answers, but I'm questioning that nurse. Is it downtrending? Are they on fluids? Why are we cycling them? Why are we checking the CK? I will purposely question them, not to be rude, but just to get them to critically think and just look at the full picture. And at the same time, at the end of the day, so next time when you do have a high CK, you will know what important information is needed with a high CK. I gotta know, why is it high? Is it uptrending? Is it downtrending? Are they on fluids? So that will be another video for sure, how to page a provider. So those are my top 4 things that you could consider. The first one being, are you ready to practice with full autonomy? Remember, you're still collaborating, but full autonomy. When you get a page or asked to treat a certain illness, will you feel confident and comfortable doing that by yourself? Secondly, again, you got to make sure you know exactly what you want to do, what you want to master in, and then where you want to end up, and that the specialty accepts the degree you obtain. And then third was the money. Make sure that if you are a nurse that likes to pick up overtime, know full well you can't get paid monthly salaries, that might be a reason why you don't want to become a nurse practitioner. So just these are, again, things that you just need to think of and consider. Lastly is the timing of you going back to school. I feel like those one-liner pages, if you really do not know or understand a patient's full clinical picture and you're just going just because lab called you and said the CK is 3,000 and that's you're just passing it on to me and not understand the full clinical picture, maybe it's not time for you to go back to school just yet. Just yet. Maybe get a couple more months, 6 months to another year. I feel like if you're going with that type of mindset into nursing school or into NP school, it's going to be harder. It's going to be harder. If you're not already critically thinking at a nurse's level, it's just going to be a harder transition when becoming an NP. It's still possible, but like I said, it's going to be just a harder transition. I still worked full time while I was in grad school. On my downtime, I'm opening charts, I'm understanding. And it felt great because it's like I open charts and based on what I'm learning in school, and I'm like, yes, that's what she was saying. That's what we'll do. I will actually test myself. This is what they're doing inpatient. So what would I do outpatient? I was reading the charts more while I was in school, which helped. So at the end of the day, there's still a lot of pros and cons when it comes to becoming a nurse practitioner. I will discuss that further in the next video because you got to see personally, will the cons outweigh the pros? At the same time, I am going to discuss that we are doing away with master's prepared nurse practitioner. So when I ask you if you want to become a nurse practitioner this year and you want to just stay at that master's level and not get your doctorate, you might as well start applying to school right now because in 2025, we are doing away with master's trained nurse practitioner. So let me end this video with our Bible verse. I'm still in Proverbs chapter 3, verse 25 to 26. It reads, "Be not afraid of sudden fear, neither of the desolation of the wicked when it comes. For the Lord shall be your confidence and shall keep your foot from being taken." So that just leads me back to this liability issue. If you go to school, pass your boards, and then the fear of just the liability, you just went through all that schooling. You have it in you. Now it's time to trust the Lord. It's time to trust the Lord. Give him your fears, give him your doubts, give him all those negative thoughts and ideas that might be floating in your mind. Give it to him because at the end of the day, you have it. If he got you through school and you passed them boards, you have it in you to practice as a nurse practitioner. You have to go all the way. Don't stop. Please seek the Lord, seek your higher power. Ask him for confidence, for wisdom, for guidance, and he will show you the way.